11 months ago today, the Bush administration decided to jeopardize health coverage for hundreds of thousands of children across the country. The Centers for Medicare and Medicaid Services sent a letter to all state health officials announcing that 1 month from today, states will be pressured to cover a much narrower range of families. They based their directive on an unfair financial standard that would exclude hundreds of thousands of children in the most difficult economic circumstances of our time. The result of that directive, I believe, would be unconscionable. It would mean hundreds of thousands of terrible stories. A child with diabetes that goes undiagnosed, a child with a cleft palate that she has to live with for the rest of her life, missed tetanus shots, untreated allergies and asthma, and hundreds of thousands of small, painful situations that would add up to a wave of tragedy too immense to imagine. Many of us in this chamber decided we weren't going to sit back and watch this happen. We sent letters, we introduced legislation, and we shouted as loudly as we could. But the President did his best to ignore us and keep his back turned on these children. In 1 month, this unbelievably harmful rule is set to come into effect. In 1 month, states will have to overcome seemingly insurmountable hurdles if they want to cover children above 250% of the poverty level. In 1 month, the strength of our values in this country will be seriously called into question. Mr. President, if it weren't for this program, these children would fall between the cracks. They're not in dire enough poverty to qualify for Medicaid, but their working parents still don't have enough to afford private coverage. The families we seek to cover work hard every day in some of the toughest jobs in our country, but they work at a job that offers no health care, and these families certainly don't make enough money to afford private coverage. The state children's health insurance program is their last resort. That's why I'm still shocked at the nerve of this administration when they unilaterally issued this harmful, cold-hearted directive on children's health. Where are those values that I've heard the administration talk about?